Tens of thousands of junior doctors in England have begun a three-day strike over pay and working conditions in the country's National Health Service. They make up around 40% of the medical workforce in the UK. Al Jazeera's Nadeem Barber joins us now from outside Guy's Hospital in London. Nadeem, what are the strikers' main demands?
Well, Adrian, they have various demands, but the main one, the huge one, is pay. I should point out to viewers that junior doctors is a label applied to people who have just qualified from medical school, right up to people who have maybe 10 years of experience and are neurosurgeons or people running whole departments responsible for hundreds of patients on a shift. So it's quite varied. And they say, their union, the British Medical Association, says that since 2008, the failure of pay to keep pace with inflation means they've had a real terms pay cut of 26%. So what they're asking the government for is a rise of 35% right now. The current pay rise of 8% over 4 years that they've had ends this month. They say they are desperate and that their profession is in dire straits. That's because those the real terms pay cuts is pushing people out of the job. They're saying that people who are very highly experienced or qualified medics are leaving for places like Australia where they can earn much more money. They're saying also that that's creating extra strain on them. They're having to work longer hours under more pressure, and they simply are being driven to do this strike, which is over 3 days. They say that the government can afford it. They're disputing what the government says the cost will be. The government says it can't go anywhere near what they want. It will be inflationary, and also simply the numbers don't add up. So there is an impasse, and the government on Friday night suddenly said, we're willing to talk on pay if you call off the strike. The union says that's not reasonable. Other health unions have actually paused their industrial action recently to enter negotiations.
Nadeem, many thanks indeed. Nadeem Barber there live at Guy's Hospital, Guy's and St Thomas Hospital in London. Andrew Myerson is a doctor who campaigns for more investment in public health.
I'm Dr. Andrew Myerson. I am an NHS A&E doctor. I originally am from the United States, and I came to the United Kingdom about 7 years ago to study medicine, and I decided to stay here because I love the NHS. We've seen, a 30% reduction in our real terms pay in the last 15 years. Basically, it means that for a quarter of the year, from September to December, we're working for free. And that's a big issue. That's a huge issue for staff retention. That's why so many people are burning out. We're seeing ads for, come to work in Australia, come to work in New Zealand, and we're seeing a lot of our colleagues who are taking, those offers to work in much better conditions with much better pay down under, because it's just becoming too difficult to work in the NHS right now. Every winter is a bad winter for the NHS, and for the last 10 years, every single winter we've been complaining to the government, things are getting worse. Waiting times are getting worse. People are coming to harm, and they are being extraordinarily successful in driving people away from the public system into a two-tier system where people that can afford it, wealthy people, they can go see private clinicians, but the rest of everybody else is left to suffer. A good shift nowadays for so many A&E staff is one where nobody dies in our waiting room or dies on the back of an ambulance. Every time I see a patient, I have to apologize for the terribly long wait that they're enduring, and I speak to them honestly about the difficulties that we're facing, that we don't have enough staff, we don't have enough resources, and so we don't want to go on strike. Nobody wants to go on strike, but when for every single year we are screaming to the government, do something, and they don't listen, then this is what it's come to. When I've gone to picket lines to support, whether it's ambulance crews or nurses, it is incredibly invigorating. As horrific as the situation is right now, it's so many people dying. Getting through the pandemic and seeing the horrors that we've been through, and feeling so awful and despairing so much about the state of the NHS, this is the one thing that's actually given me hope.